Good morning, good afternoon, and good evening, everyone, wherever in the world you may be joining us from today. My name is Francesco Del Carpio, and I am the CFA York Operations Coordinator. I would like to officially open the fourth session of the Student Nurses Voices Speaker Series, Student Nurses Voices from the Western Pacific. This series is being presented in partnership with the Nightingale Initiative for Global Health and sponsored by the Integrative Nurse Coach Academy, the Global Academy of Holistic Nursing, and the Commonwealth Nurses and Midwives Foundation. I would like to begin today with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have longstanding relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Tikaranto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderators, our speakers, and our participants from around the world. Welcome to our webinar. It's now my great pleasure to introduce our moderators today, Dr. Diva Marie Beck and Dr. Maria Teresa or Tess Panasalis, both from the Nightingale Initiative for Global Health. For the sake of time, their full bios and the bios of all of today's speakers will be posted in the chat. Dr. Beck and Dr. Panasalis, thank you very much for moderating today's session and for all of your work in putting this series together. The floor is yours.
Thank you, Francesco. Thank you for all your work. Welcome to all of you. We have 16 speakers in addition to Tess, and this is a wonderful, innovative project, and we're so grateful for everyone who's participating and everyone who's in the audience today. Before Tess opens, I'd like to just say one more thing about this project. People often say to me, well, nurses are interested in tools and tasks. And where are the tools and tasks for global health? And my answer is our tools are social media, YouTube, platforms like this, and our tasks are to be communicators, leading edge thought influencers. And you are all doing your tools and tasks in this project, those of you who are speaking and those of you who are listening. Thank you so much. And now it is my privilege to be welcoming dear colleague and friend, Dr. Maria Teresa Tess Panasalis. Tess opens our session with a prayer, with a reading, a poem that she has written, and we have the PowerPoint, and she reads it too. Tess, welcome.
Thank you, Diva. Thank you so much. We're so excited to have all of you and to listen to you. As I was just mentioning today to my colleagues at work, I said, well, that's why we got 2 ears so we can listen. And we truly want to listen and hear. And, you are the future of nurses, of our nursing profession. So, yes, Francesco, we could start with a poem. Thank you. The healers. It hurts to see the suffering. Our patients, our communities, our world. To be a witness where care cannot be reached, where care cannot be given, where care is a high price to pay. To hold the hands when life slips, when the newborn drifts, when honor and values are robbed, when our very own identity is such that is left unknown. The humanness of being a nurse yes to all of you, is more than what is visible. It is what is within. One who longs for a just world, for peace in the midst of all suffering, or the moment of fleeting joy. One who dares to fight, to hold hands with you, with everyone. As we too are your partners. We too are part of that circle. We too are healers. In building a better world. That seems to set our tone, Diva.
Well, yes, indeed. And it's amazing how relevant how even more relevant it is today,
Yeah.
and even the last time we aired this in January. Thank you so much.
Yeah, I absolutely agree. You know, it makes my heart flutter every time I read it.
Yes, indeed. So thank you, Tess. It is my task, a tool, my privilege, to be introducing our dear friend and colleague, Elizabeth Iro from the Cook Islands. I first met Elizabeth at the World Health Organization when she was taking the role of the Chief Nursing Officer at WHO between 2018 and 2022. She oversaw the COVID epidemic and also the 2020 WHO International Year of the Nurse. Welcome, Elizabeth. We are so grateful that you are our regional introduction. Elizabeth.
Thank you very much. Well, good morning and good afternoon and good evening to all who have joined us for this session. Greetings also to my fellow panelists and our moderators, Dr. Tess and Dr. Beck. Thank you, Diva, for the invitation once again to be a part of this session. And I take this opportunity to thank all those individuals and organizations for continuing to pursue excellence in nursing. I want to acknowledge the host and sponsors of the United Nations Institute of Training and Research, UNITA's CFL York Centre for Training at York University in Toronto, Canada, and the Nightingale Initiative for Global Health. Thank you once again for this really important initiative. I want to congratulate all those who have chosen nursing as their career and the young nursing leaders among you that are already on your way to making a difference to the health of people in your country, because already you are contributing to the achievement of the SDG 3, Health for All, as well as to other SDGs, such as in SDG 4 and SDG 8. Why nursing? Many of us choose this career path for many different reasons. And these could range from knowing that there is a high demand for nurses in our communities because of job securities it offers, because you are aware of opportunities for career advancement, you have a passion for helping and caring for people, or because of the flexibility with work hours. Whatever the reason might be, thank you for choosing nursing. Nursing is a profession where there is always a continuous learning environment. So as you progress from your student environment to a practice environment, maybe in a clinical space in a community-oriented or research environment, I know your leadership journey has already begun and is evolving. Some of you may have started your nursing careers without thinking about the SDGs, and I know many nurses start their shifts without thinking about the SDGs. But you know, much of the work you do every day in caring for your patients, their families, and your communities contribute to your country health targets, and therefore to the global health targets. So your role as global leaders has really already begun. At this level of leadership, your fundamental principles and values become the necessary moral compass to guide your journey. At various levels of leadership, a political level, it is important to be honest and recognize the importance of maintaining your integrity and make the necessary call and decisions, not because you have been asked to do so, but because it is the right thing to do. Paying close attention to advancements in healthcare and understanding how new approaches to care can improve patient outcomes and to facilitate better experiences is the key. Making necessary changes based on the evidence through policy options, regulations, and legislation, and influencing, collaborating with the medical and allied health professionals we work with for the value add necessary for improving our patients' health outcomes remains critical. The network one builds over time, investing in these relationships opens opportunities for one as a leader. Collaboration with key stakeholders allows for a wider scope in one's advancement in leadership, but it demands a positive attitude and managing activities through trust and kindness. I suppose you may have heard that people prefer to work with those they know, they like, and trust. This is the power of investing in your network. From my own experience, and unbeknown to me at the time of my appointment as the Chief Nursing Officer of the World Health Organization, there were key individuals that had been a part of my network from my days as a nurse or as a midwife in the hospital wards, who went on to also work or were leading global international nursing and midwifery organizations based in Switzerland, in Europe, and many parts of the world. You have your leadership journey ahead, and I wish you well at the crossroads when tough decisions need to be made. My takeaway message to you all today is enjoy what you are doing, establish trusting relationships, and continue to build your network. I thank you.
Thank you so much, Elizabeth. You know, it's always lovely to have you and to give us that power to remind ourselves of our values, of our integrity that we bring to the workforce, you know, and to those that we served, that we chose to serve. Thank you so much. So as we move forward, we would like to welcome our next speaker, Dr. Yong Lee. So I hope I did that right. She has been collaborating with us for the second time. And she's the director of the World Health Organization Collaborating Center, director of International Nursing Education Center, and professor in Community Health Nursing and Global Health at Yonsei University College of Nursing in Seoul, Korea.
Thank you, Tess.
Welcome.
Thank you. Hi, everyone. Yonsei University College of Nursing is the first and the best nursing school in Korea with the core value of innovation, leadership, and social responsibility to shape the future of healthcare since our establishment in 1906. I'm so delighted to participate in this meaningful event and to support our students in sharing their insight on a global stage. As expressed in the poem introduced by Tess, there is no place in life without nursing, and no one untouched by its care. I hope the voices of the nursing profession will reach even further to bring a better world and peace to all. As a dean, I take great pride in seeing our student nurses contribute to thought leadership and advancement of nursing. This opportunity allows them to expand their knowledge, exchange experiences, and strengthen their voices in global health. I'm also grateful for this wonderful opportunity to connect Yonsei with the nursing professionals from many countries around the world who are participating today. First, I would like to introduce a doctoral student, Hyeonkyeong from our university. Hyeonkyeong has clinical experiences as a nurse in pediatric intensive care unit and is now a full-time PhD student. She actively participated in global leadership activities such as international exchange programs since her undergraduate program, and has a strong interest in children's health issues worldwide. She continues to demonstrate outstanding achievement and leadership in graduate school, proving to be a promising nursing scientist and future leader. Please join me in welcoming Hyeonkyeong as she shares her story.
Thank you so much for that introduction, Professor Hyeonkyeong Lee. Greetings, everyone. My name is Hyeonkyeong. I'm currently pursuing my PhD at Yonsei University College of Nursing in South Korea. As a student nurse and a member of a global nursing community, I feel truly honored to share my nursing story and perspective with fellow nursing students today. I had the privilege of studying nursing in both the United States and South Korea. This experience opened my eyes to the global nursing and gave me a deeper sense of what it means to be part of the global nursing citizenship. After graduation, my nursing career started at the Pediatric Intensive Care Unit at Severance Hospital, one of the biggest PICUs in South Korea. During that time, I took care of critically ill children, including pediatric cancer patients, and also patients undergoing kidney, lung, and liver transplants. My patients ranged from just a month old to 18 years old, and many of them had to go through unimaginable challenges to survive. I witnessed both joys and sorrows of life, not just for the children, but also for their families. Those children were my greatest teacher. Their strength, courage, and unbreakable spirit have shown me the true essence of nursing. I became an advocate for children and their families, trying my best to provide the best nursing care and the emotional support they need in PICU. However, as my nursing career has progressed, my nursing perspective has expanded from hospital-based care to community health nursing. I came to realize just how important it is to support children with medical complexity, especially during the transition from acute hospital care to long-term care at home. My passion for helping vulnerable children has only grown as global challenges like pandemic, wars, and climate change continue to threaten the healthcare and well-being of those who are most at risk, making it even harder for them to assess the care they need. In South Korea, the healthcare system is facing big challenges such as ongoing medical policy debate, the shortage of pediatric doctors and nurses, and growing gaps in healthcare between regions. On top of that, advances in assisted reproductive technology had led more multiple births and rise in children with disability, making pediatric care even more complex. As this issue is becoming increasingly complex, I recognize a growing responsibility as a pediatric nursing scholar to develop evidence-based intervention and contribute to policies that enhance care and support for these vulnerable populations. The Nightingale Declaration reminds us that we are the part of the global nursing community, united in our commitment to create healthier and more compassionate world. It inspires us to support one another and make a meaningful difference in the lives of those who we care for. I truly believe that by working together as a global nursing community, we can bridge the healthcare disparity and build a system that can provide care for everyone, no matter where they are. With this belief, I will continue to live my life by the spirit of Nightingale as a nursing scholar, educator, and a leader, collaborating with nurses around the world to make this vision a reality. Thank you so much for your attention.
Thank you. Thank you for your wonderful presentation. Now I'm moving to another presenter. I'm very delighted to introduce another future leader, Yuna. She is a student who is deeply committed to social contribution and global health, actively gaining diverse experiences and demonstrating leadership here on campus. As a student nurse, she has not only excelled in nursing, but also takes initiative in addressing various social issues, serving as a student club president and actively participating in global health project activities. Please join me in welcoming Yuna.
Thank you for the introduction, Professor Hyeonkyeong Lee. And hello, everyone. My name is Yuna, and I am a graduating nursing student from the Yonsei University, South Korea. It is a pleasure to be here today to share my experience as a student nurse. When I first entered nursing school, there was this specific phrase that was stuck in my head for a very long time, that nursing is a both human art and a science. At first, I really struggled to grasp the full meaning of this. It was quite a mystery. However, as I progressed in my studies, I realized that nursing is not just about knowledge, but it is about the skills and understanding people in both their physical and social context. This realization really helped me guide the gradual process of enlightenment and became my motivation throughout the nursing school journey. Throughout my academic journey, I have come to appreciate that nursing is a field with vast opportunities for growth and specialization, especially in the field of addressing the social issues and global health. My journey here at the Yonsei University has not only helped me shape my clinical skills, but also transform my perspective on nursing and global health. One of the most impactful experiences was participating in the Yonsei Global Health Initiative, which was abbreviated into YGHLC. This took place in various countries, including Korea, Mongolia, Cambodia, and Vietnam. And it helped me to learn about the various healthcare systems in each country and engage in community-based health initiatives. During this program, I had a chance to visit the various countries too, and I would like to say that I had a key 3 takeaways from this course, which was first, interdisciplinary collaboration, second, cultural competency in healthcare, and third, theory in action. First, communicating with the students in various fields of healthcare, I strengthened my ability to adopt the multidisciplinary approach to the healthcare. It is important to collect the information from different providers and different healthcare providers and see how effective collaboration between ourselves could actually improve the patient's status and improve the information in general. This is really crucial in improving the outcomes, and it was really delightful to witness this. Next, engaging in local healthcare workers and patients, I gained a deeper understanding of how cultural and socioeconomic factors really shape the health practices and accessibility, especially addressing the public health challenges in Mongolia, such as respiratory disease due to atmospheric pollution, really helped me to concentrate on one issue and help us focus on this problem to suggest a solution. Lastly, witnessing the theory being applied to the real-world settings was deeply fulfilling, not just as a student, but as someone who can clinically practice. Whether it was participating in healthcare education program or assisting in the outreach activities, I felt a sense of purpose in bridging the academic learning with the community impact. This experience really broadened my vision in nursing and reinforced my commitment to global health and community-centered care. Yonsei's nursing program, along with opportunities like this, has equipped me with the skills, the mindset, and the passion to contribute to both local and global health initiatives. This really motivated me to found the Nursing to be Global Leaders, the student-led organization group under Professor Hyeonkyeong Lee's guidance. This organization is dedicated to fostering the leadership and the global engagement among student nurses in the Yonsei University. We do weekly activities such as discussion and picking the article to discuss effective evidence-based practices. Through NTGs and through our small efforts, I aim to prepare a ground and a platform where students can exchange knowledge and discuss international health issues and slowly develop our skills. As I continue my journey with my fellow nursing students, I am strongly committed to strengthen my role of nurses in global health, and I will carry these lessons with me, striving to become a nurse who does not only provide care, but also advocates for a health solutions worldwide. Thank you for listening.
Thank you so much. It's so lovely to hear all these experiences and how you have tackled, and be part of a solution in our global health issues. So thank you very much, Dr. Lee. Thank you, Yuna and Kira, for the presentation you have just delivered. So as we move forward, I would like to introduce our next set of speakers. And that is from Centro Escolar University, led by Dr. Pearl Ed Cuevas, who has collaborated with us for the third time now. And she's the associate professor in the same university located in Manila, Philippines. She is with a graduate school as well on the Centro Escolar University. And gladly, she is my co-author on the book that we have published with regards to nursing journey.
Thank
Dr.
you.
Cuevas.
Thank you, Dr. Panizales. It's been great to be with the for the Nightingales Initiative for Global Health. We've been together for the 3 sessions and it's been a pleasure. So greetings from Manila, Philippines. Teaching is such a rewarding opportunity to share our talents and experiences to enrich the lives of others. It's a selfless act that benefits both the teacher and the student in a symbiotic relationship. I've been teaching nursing for 22 years now at Centro Escolar University in Manila, and this is located near the Malacañang Palace where the President of the Philippines resides. Established in 1907, we are one of the leading private educational institutions in the Philippines, known for its strong emphasis on academic excellence and its holistic development of our students. The School of Nursing offers high-quality nursing programs with focus on developing skills, compassionate and competent care from nurses or from Escolarian nurses. The program includes undergraduate and graduate degrees that equip students with the knowledge and practical skills required for the healthcare profession. Our graduate school at Centro Escolar University provides advanced education through various master's and doctoral programs aiming to develop professionals capable for leadership roles in various fields. And that is the reason why we have invited here today our graduate students who are also nursing leaders in the Philippines. The CEU Graduate School offers programs in health sciences with an emphasis on research, innovation, and global perspectives. Today, I'm pleased to introduce to you our first speaker for this webinar. Mr. Ryan A. Hitalia, a CEU graduate student, Master of Science in Nursing, major in Medical Surgical Nursing, also graduated from the same university with a Bachelor of Science in Nursing in the year 2000. He currently serves as the department head of the Stoma and Complex Wound Care Center at the Medical City Hospital in Manila, Philippines, where he has been currently working for the past 22 years. Before that, for 13 years, he has specialized in ostomy and amputation wound care, having trained in Penang, Malaysia. In 2010, for his Enterostomal Therapy Nurse Education Program, or ETNEP, under the World Council of Enterostomal Therapists, he is an international delegate from the Philippines. He also holds certifications in breast cancer lesion lesion management in Kuala Lumpur in 2010, diabetes foot nursing in the NUHS Singapore 2013, and a specialized trainer certificate in tissue viability and chronic wound management in Hamburg, Germany in 2017. This is recognized by the European Wound Management Association. Mr. Hitali is also a professor at the School of Nursing in Centro Escolar University, Malolos and Manila. He holds a diploma in leadership and management from Ateneo de Manila School of Business, a certificate in entrepreneurship from Harvard Education, and a certificate in innovation in healthcare and management from Thunderbird Business School. He is the current national president of the Enterostomal Therapy Nurses Association of the Philippines, a founding member of the Philippine Wound Care Society, and a member of the ASEAN Wound Council and the Asia Pacific Enterostomal Therapy Nurses Association. He's also involved in various other associations and societies related to ostomy and wound care, both in the Philippines and internationally. Let us now hear the triumphs and challenges of Ryan. I now give you the floor.
Thank you very much, Dr. Pearl. And of course, it is an honor to be introduced by my mentor. And I would also like to thank the organizers and the committee by having me involved in this very great program for nurses. So again, I'm Ryan, and I specialize in ostomy and wound care. And I would like to share a journey wherein it only started from a dream, wherein it led to a global mission, proving that nurses are not only caregivers, but also leaders, innovators, and change makers in our own field of specialty. So early in my career, actually, it was a friend of mine, a colorectal surgeon, who encouraged me to undergo a specialization in the field of ostomy and wound care. And this is because every time that I encountered a patient who has undergone stoma surgery, most of them are overwhelmed and afraid of how life would change, no? And very uncertain about how to care for themselves, and not only them but also their loved ones, no, as well. So it's not just a wound but actually a life transition for everyone. So as I guided them through their recovery, I realized that proper education, compassionate care could restore confidence, dignity, and independence. So that moment ignited my passion on pursuing a specialty in nursing, which is actually ostomy and wound care. Wherein during that time in the Philippines, there's only a handful of us. Actually, there's only one nurse specialist in a country wherein is number one producer of nurses. No? And for me, nursing is about advocacy, about empowerment, and my role is not just to provide medical care, but to also educate, support, and to restore the confidence of patients who have ostomy and wound, and improving their quality of lives, and having the life with dignity. So I see nursing as a bridge between medical innovation and actually compassionate care, ensuring that patients receive the best possible treatment while feeling heard and also being valued. So one of the strengths of our profession is the resilience and adaptability of nurses, especially in the field of nursing specializations, for example, like ostomy and wound care. So we have developed nurse-led initiative programs that empowered specialized nurses to take the lead in managing complex conditions. However, there are gaps, particularly when it comes to training, awareness, and accessibility of modern wound care techniques or wound care ostomy techniques when it comes to the different regions of the country. Many nurses still rely on outdated practices. One of the reasons maybe is of their comfort zones. And we know that change is sometimes difficult to accept. And again, there is a need to bridge this gap through proper collaboration, education, and another thing is policy changes. The passion led me to help establish and lead a stoma and complex wound care center at the hospital where I work with in Manila right after my training in 2010. And then when we started, we only saw a few handful of patients because of, again, the trust and confidence of patients to nurses, wherein there is no doctor present. Now, We're in nowadays, no? Presently, we have 80 to 90 patients in a day on our outpatients and 30 patients. Wherein nurses are the spearheaders of this empowerment. And our center is now recognized actually not only locally but also internationally in the Asia Pacific region when it comes to benchmarking, and has become for a model when it comes to advanced and ostomy wound care. So I did not stop there. I'm still hungry for more knowledge and think of what I can do more for my fellow nurses and also for the patients. So I keep on studying and training to different countries, making new friends and collaborations and connections also. So this also lead to the university's initiative to have a training program for nurses in the Philippines when it comes to tissue viability, ostomy, and wound care. Beyond patient care, I saw an opportunity for nurses to take the lead in transforming healthcare. And this also led to, by me becoming, again, involved into different societies wherein nurses should be introduced and should be unknown when it comes to nursing specializations. At this stage, I recognize the importance of mentorship and leadership. And as the department of the center where I work with, I want to guide also young nurses and foster innovation and contribute to global discussions when it comes to the specialty where I am. I believe that by sharing my expertise can help shape the future in specialized nursing in the Philippines and hopefully in other countries as well, wherein the biggest challenge is limited access to advanced wound care solutions, especially into developing countries like the Philippines. Many patients, especially those with diabetic foot ulcers or ostomies, do not receive timely interventions due to financial and systematic barriers, wherein we need interdisciplinary collaboration and research, and again, policy changes to make evidence-based practice accessible to all. So to all student nurses listening today, you are the future of healthcare. Your knowledge, compassion, and leadership can transform lives. Dare to specialize, dare to lead, and dare to innovate. Find your passion, pursue excellence, and never underestimate the impact that you make, whether it's at the bedside or at the global stage. No? So again, I would like to thank everyone for coming over, and um, I think the change when it comes to nursing practice would start from ourselves as well. Thank you very much for your attention.
Very, very well said, Ryan. Thank you for this enlightening presentation. Our next speaker is also a nursing leader in diabetes care and nursing education in the Philippines. She is also an alumnus of our university, having graduated in the year 1991. She is now serving her alma mater. May Angeline M. Lontok is the current program head of the nursing department of Centro Escolar University Makati, and with over 21 years of experience as a nurse educator and 11 years in her current leadership role, she has made significant contributions to the field of nursing education. May Angeline is dedicated to preparing future nurses to be globally competent and well-equipped, ensuring that they are ready to meet the challenges of the healthcare profession. She currently serves as the treasurer of the Philippine Association of Diabetes Care and Education Nurse Specialists Incorporated, or PADSENS, demonstrating her commitment to advancing diabetes care and education in the Philippines. Thank you for what you do, May. We are now ready to hear your stories and to listen to your presentation.
Hi, good morning, everyone, or hi, hello, am I audible? Okay. Thank you very much for this opportunity to share some of the insights and at least a learning that I also get to have. I am currently the program head of the nursing department here in CU Makati. Okay. It is actually my pleasure to be here with you sharing this time. You when I was reflecting and trying to come up with what am I to talk about? Okay, I came up with a phrase by Yeats or W. Yeats, which he said, education is not just filling a pail, but you light up a fire. Okay, as nurse educator, we have that profound privilege of igniting the passion for nursing in our students. We are here not just to impart knowledge, but to actually inspire and transform the future of healthcare. Okay, no, Philippines being known as one of the main providers of nurses all over the world. Okay, it has become a challenge for me, or it has actually given me more bigger responsibility on the shoulder, because it means that I have to make sure that the nurses that comes out from the Philippines is really ready to face the world and the challenges of becoming professionals. Okay, I just want to share with you one incident, or should I say um a situation that I had, that I met one of our alumni, one of my former students. And it was when I was with my parents, when I brought them to the hospital for for a checkup. And this student came to me with full smiles and said, "Mom, do you still remember me? I'm very happy to see you. I have finally had a chance to thank you and let you know that I have learned so much from you." Then I was really trying to recall what year she was when she was my student. And she said, "I appreciate everything, especially the values that you have taught us, more than just the knowledge and the skills. I vividly remember that you said in our class, we cannot fake care." So that phrase, that statement has warmed my heart and made me reflect and gave me the affirmation that I am doing something good in my life. It is through mentorship and dedication and guidance I have watched them transform into a confident and compassionate nurse. Witnessing their journey reminded me of the profound impact that we educators have on them. Okay, nursing education is about more than imparting knowledge and skills, as what my former student had said. It's about nurturing the next generation of nurses. It's instilling in them the values of empathy, resilience, as what Ryan is also mentioning, and the unwavering dedication. We are the mentors who guide our students to become not just competent nurses, but compassionate care providers. We have the unique opportunity to shape their perspectives, instill ethical values, and ignite their passion for patient care, more than just looking into the profession as a good source of income or financial stability. Okay. It is from that situation that it made me realize what is the purpose in nursing, what is our purpose in the nursing education? What is the purpose of nurse educators? It actually extends beyond the classroom and clinical settings. We inspire our students to see the bigger picture, to understand the profound impact they have on their patients' lives, little the little touches that they give, the way they hold their hands, okay, the way that they dress their wounds, or just simply just sitting beside them and listening to how they are feeling for the day actually touches our patients' lives. Our role is not just to teach, but to empower and inspire. We try to foster a learning environment that encourages critical thinking and innovation. We try to prepare our students to face the dynamic challenges of healthcare industry. Mentioning the challenges, yes, there are challenges as our role as nurse educators. um we have to keep up with the advancements in healthcare. We have to make sure that we know what is the latest, what is it now that is being practiced. We have to know how to address diverse learning needs, especially our students nowadays. They have different learning needs. They have different ways of learning. So we have to be adept to how they are learning, so that they would really get the things that we are imparting on them. We have to manage the emotional demands of our profession as well. But the rewards are really immeasurable. like when alumni gets to come over and visit, and they would say thank you and tell you that we're here already and we're doing good. It is because they look back to what you have imparted on them. That actually is the biggest reward. It's not just the gifts that they bring home to you, but it's actually the gift of acknowledging that you have been a part of their journey in their profession. Every student's success, every aha moment that they have, and every life that they go on to touch reaffirms our purpose and fuels our passion. Seeing our students graduate and succeed in their careers, knowing that we played a part in their journey, is incredibly fulfilling. So with this, let this be a reminder to us nurse educators that our role is matters immensely. In the hustle and bustle of daily responsibilities, it's easy to forget the profound difference that we make. We just try to live by the day, by the task, but we tend to forget that we actually make an impact into our students. Let us take pride in our role, embrace the challenges, and continue to grow both professionally and personally. Together, we can shape the future of nursing and elevate the standard of care. Remember that each lesson we teach, each skill we demonstrate, and each word of encouragement we offer has the potential to change lives. Good day, everyone. I hope I have enlightened you with my insights. Thank you.
Thank you very much for that, especially Centro Escolar brought to us right now the perspective of educators. So as we move from Centro Escolar group, we're now welcoming for the first time Dr. Wu, Dr. Ying Helen Wu, who is the professor, former dean of Capital Medical University School of Nursing, the dean of Clinical Nursing College, Capital Medical University in Beijing, China. Dr. Wu.
Excuse me just a minute, Tess and Dr. Wu. From now on, the professors, just to remember that the bios are in the chat. And so a full-on bio that takes quite a bit of time doesn't need to be said because it's right there in the chat when people speak. From now on, professors, please keep it a little shorter. Thank you so much. And Dr. Wu, you are so welcome.
Thank you.
Thank you. Good morning, good afternoon, and good evening, Dr. Beck. Thank you very much for your very kind of invitation. And it is truly my honor to be here to participate in this discussion alongside with my two PhD students. Today actually is the February 12th in Beijing, and that's the Lantern Festival, a special occasion marking the end of Chinese New Year. And so it is a time for reunion, reflection, and looking ahead with hope and enthusiasm. Now, as introduced by Dr. Beck, I'm Ying, but most of my international friends call me Helen. I was the former dean of the Capital Medical University School of Nursing, one of the most prestigious nursing institutes in China. I also served as the dean of the Capital Medical University Clinical Nursing College, which integrates all of nursing resources in our 34 hospitals. So with my 4 decades of experience, I have dedicated my career to advancing nursing education practice, accreditation, practice, and policy at both national and international levels. I also served as the Vice President of Chinese Nursing Association and the Chair of the Nursing Discipline Appraisal Group of the Academic Degrees Committee of the State Council, which is responsible for developing and renewing our national standards for graduate nursing education. Also, I served as the inaugural chair of Working Commission for Nursing Education Accreditation of the Ministry of Education and developed the first comprehensive nursing programmatic accreditation system. Internationally, I have served as an ICN board president of Asia Pacific Association for Medical Informatics and the vice president of International Medical Informatics, champion digital health and nursing artificial intelligence in China and internationally. So our research has been focused on artificial intelligence, large language models, and advancing intelligent nursing care in geriatrics, NCD management, ICU care, and virtual reality for education. We also established the first basic nursing research lab to explore the underlying mechanisms of nursing phenomena using omics. Currently, I'm also a candidate for the ICN presidency. And so I'm deeply committed to enhancing the global visibility and recognition of nursing through research and collect evidence. So in terms of nursing education and workforce development, China has developed for a 4-tier nursing education system covering diploma, associate degree, bachelor degree, master, and PhD degree education. Over the past 20 years, China has expanded and standardized nursing education and ensuring alignment with international standards. So the number of nurses by the end of last year has reached almost 6 million, which account for 1/4 of global nursing workforce. Now, my 2 PhD students, as I mentioned, our research team is dedicated to interdisciplinary research, integrating new technologies, including artificial intelligence, virtual reality, and large language models into nursing education and nursing practice. So I will highlight 2 specific research. First, to address the inadequacy of clinical decision-making ability among nursing students and the limitation of practice in the clinical settings. We have innovatively introduced virtual reality into nursing education. So my first PhD student, Ying Wang, is the key contributor to this research project. Her work is exploring nursing knowledge representation and in combination with large language models for developing AI-driven high-fidelity scenario generating system using virtual reality that allows students to practice complex decision-making skills in a realistic yet risk-free environment. So her topic today is enhancing clinical decision-making through virtual reality. So please join me to welcome Ying.
Hello, everyone. It's a pleasure to be here today. I would like to thank Dr. Beck, Dr. Panelists for organizing this impressive student nurses force session, which allows nursing students to share our feelings and opinions. And also thank you very much, my mentor, Dr. Ying, for your part of introduction. My name is Ying Wan, and I'm a registered nurse and a PhD student at Capital Medical University in China. At the beginning of my career, I was trained at a hospital as an intern nurse. I had just completed my foundational education and began working at the patient bedside from early morning until night. I took vital signs, gathered patient history, and administered medicines and treatments. I was always trying to help patients with my knowledge. And some problems are well within my capabilities, but others were beyond my scope. I vividly remembered an emergency situation happened when a patient was struggling to breathe. Her hands firmly pressed her left chest, and the monitor kept alarming. All these questions came to me like, what's happened and what's my top priority things to do? I had limited experience with emergency procedures and felt unsure about how to make the correct decisions and act quickly. It was in that moment that I realized the gap in my training. I could follow protocols and basic procedures, but I wasn't fully prepared for making quick decisions in high-pressure situations as a student nurse. 3 years have passed since then, but I still remember the nervousness and the frustration I felt during my transition from nursing student to a novice nurse. So I want to help nursing students in similar situations to improve their abilities to adapt to the clinical environment and ease the transition from school to practice. And then I had the opportunity to join our Dr. Ying Wu's research team and became a PhD student. We focused on enhancing nursing student clinical decision-making abilities through virtual reality and artificial intelligence technologies. It's crucial for the nurses to make accurate decisions to ensure patient safety and health, and to minimize the risk of mistakes and harm. However, in clinical settings, students often don't receive enough training, especially when it comes to handling emergencies or rapid change situations that demand swift and correct decisions especially. As a result, students often lack opportunities for trial and error in a real clinical environment. With the use of virtual reality and artificial intelligence technologies, we've developed an immersive three-dimensional clinical environment where students can interact with different virtual patients who had the same disease or without varying degree of severity. The system automatically generated different scenarios, allowing students to practice independently as many times as they can as needed to strengthen their decision-making abilities. This system also tracks the students' responses and provide feedback, helping them recognize areas for improvement and adapt their strategies accordingly. We also conducted a randomized controlled trial at 8 universities across China, which showed that the students successfully improved their clinical decision-making abilities in emergency heart attack scenarios. Some of the participants mentioned that it boosted their confidence for future clinical practice. So that is my research. In China alone, there are 300,000 nursing students became new nurses every year. I hope that my research will help more nursing students and can better equip the next generation of nurses for the global health care challenges ahead. And thank you again for this opportunity to let me share a bit of my story and connect with you all today. Thank you.
Thank you. That's really great. So your next presenter, Dr. Wu, is Ms.
My next present is also my third-year PhD student, Rongrong Guo. And in response to the practice challenge of current intelligent home-based elderly care systems, so we are exploring an elderly-centered, intelligent, and integrated elderly care models that align with the needs of and the preference of all stakeholders. And also we are exploring incentive mechanisms to integrate all the stakeholder efforts and enable the system to operate automatically. So Rongrong Guo is the main contributor of this research, and her topic today is the development of the smart system and the underlying insensitive mechanism to facilitate integrated elderly care. Now, please join me to welcome Rongrong Guo.
Thanks a lot for the introduction by my supervisor. And good morning, good afternoon, good evening, everyone. I'm so honored to share at the Nurse Students Voice webinar. Then, have any of you ever been asked this question? Why did you choose nursing? Or heard someone else share their experience with this question? Actually, I have been asked asked this question many times since my undergraduate years. I have been searching for my why. Thankfully, I think I finally found it. As the aging population grows and the number of individuals with disability increases, the elderly care burden is escalating globally. The complex medical and social care needs of older adults require the collaboration of multiple care providers, leading to fragmented care. Previous research has explored intelligent care models to facilitate continuous monitoring, information sharing, consultation, and timely feedback. But do the systems truly address the challenges in elder care? Unfortunately, the answer is no. Most current systems depend on AI solutions, which can produce inaccurate or even conflicting recommendations, and they often lack integration among care providers and elderly individuals. In response, we have developed an intelligent and integrated elderly care model using a knowledge-based clinical decision support system architecture. Similar to how the neural reflex functions in biological systems, it consists of sensors and scales, serves as a receptor. A mobile phone autonomous response system serves as the central nervous system in the spinal cord, and a remote cloud management. It serves as the central nervous system in the brain, and a total care system serves as the effector where various care institutions are incorporated to assume responsibility for different care services, collectively referred to as the smart system. It can diagnose care problems and customize care plans based on the collected data, thereby promoting integrated, continuous, and personalized elderly care. RCT has confirmed the efficacy in improving quality of life, health self-management ability, and social support while reducing ADL disability among elderly individuals. However, we have seen many elderly individuals with physical or cognitive disability show low acceptance of these smart care systems, despite their care needs. This limits opportunities for care providers, further compounded by long investment cycles, high risks, low returns, and lack of standardization in elderly care. So, how can we break through this dilemma and truly help elderly people? An incentive mechanism is essential for balancing the care system and achieving care objectives by coordinating interactions between elderly individuals and care providers. So, what are the behaviors, preferences, and potential influencing factors of elderly individuals? What about those of care providers? How do positive and negative feedback occur between them? Economic principles like evolutionary game theory, nudging theory, and mechanism design theory offer interesting insights. How can we tackle the challenges in elderly care? I hope our research can bridge the gap between technological advancements and the practical and needs and preferences of elderly individuals and care providers, and contribute to a sustainable elderly care ecosystem, ultimately leading to a tangible improvement in their functional status and quality of life. This is my why. I believe that one day, elderly individuals will hear the voices from nursing. Thanks a lot for your listening. I'm looking forward to the upcoming discussions. Thank you.
Thank you so much from our group, headed by Dr. Wu, and of course, Ms. Wang and Ms. Gu. Great presentations. So as we move forward, again, we'd like to remind, I know we are crossing our schedule is not being followed right now, but we really, enjoyed all the conversations. So please, our bios are posted in our chat room, and therefore we would just proceed and announce for the rest of our presenters as well. So our next presentation is coming from the Western Pacific sub-area of Asia, which is led right now by Megumi Teshima, who is the Board of Directors of that Western Pacific sub-area of Asia International Council of Nurses, and the Vice President and Dean, Graduate School at Tokyo Healthcare University. Dr. Teshima?
Yes. Hello, everyone. I am Megumi Teshima. I would like to thank you, Dr. Beck and Dr. Josie and Francesco and everyone at York University who organized this event, and also the fantastic moderator, Dr. Marie Tess. I appreciate having me as a speaker again. Last year, Japan was just hit by a major earthquake in Ishikawa area, and we shared the voice of nurses who were in the midst of suffering. Nurses over there are still working hard for support people and the community for recovery. Sharing nurses' voice as an experience with people around the world should have an opportunity for the affected nurse to regain their spirit. By the way, as Dr. Tess introduced, I am a board member of ICN and currently considering a project to deepen dialogue with nursing students. ICN is considering that the new project, dialogue with nursing students and nurses in the early stage of their career. Therefore, this NIGH Student Nurses Voice Project is very timely. In the Asian countries I represent, including Japan, the population is aging. And the question of who will care for the elderly and how is being asked. Yes, Long Ku's study she just presented will contribute to get new model of elderly care. Thank you. In addition, people living in island are greatly from climate change. I think it is very important to share these issues related to health and work with them together, the next generation of nursing professionals. Last night, we had a meeting for the ICN Congress in Helsinki, starting June 9th. We will see you together over there. And I am currently the Vice President of Tokyo Healthcare University, which has the largest number of nursing students in Japan. Consists of 5 campuses with over 2,600 students, including graduate students. The graduate school places a strong emphasis on nurse practitioner, and about 1/3 of all NPs in Japan are our graduates, and they are active throughout Japan. Today, I would like to introduce 2 excellent undergraduate students, Kiri-san and Nana-san, who will be speaking to us. When I had a dialogue with them, I was so moved by their pure stories and compassion to be a nurse. And it reminded me of myself when I was young. So, Kiri and Nana, it's your turn. The first speaker will be Kiri-san. Please take your microphone.
Thank you, Professor Teshima. Good morning, good afternoon, and good evening, everyone. Hello, my name is Kiri Fukushima. I'm deeply grateful for this opportunity to share my nursing journey with you all today. I have come to realize that a nurse's role is to heal people's physical, emotional, and psychological illnesses after studying nursing these past 3 years. First, I want to explain how I became interested in nursing. My mother was diagnosed with breast cancer when I was 14 years old. My mother was really worried about her cancer and her treatment when she was hospitalized. However, my mother's nurse said to her, "There will come a time when it gets better." This experience made me realize that nursing is not only a profession that treats the sick. I want to be a nurse who, like my mother's nurse, can treat both physical illnesses but also provide peace of mind to her patients. At first, I was interested in the field of ER or surgery because I had a strong attraction to saving lives. However, I'm now interested in psychiatric nursing. I learned that in Japan, patients with physical problems have mental conditions are often denied hospitalization because of their mental disorders. I also learned that some patients are forced to stay in the hospital for long periods because they cannot find a place to be discharged due to prejudice against people suffering from mental illness. As an example, I have joined in nursing internships in various departments for the past 5 months, and during my psychiatric nursing practice, I took care of patients with suffering from schizophrenia. The patient had completed her inpatient treatment, but she was very worried about being discharged because she didn't know where she would live. For a personal example, I have a close relative who also suffers from developmental and mental disabilities. My relative can live among society but gets nervous easily. I think it is very difficult to remove mental and psychological distress through medical treatment. It is important to listen to the patient's thoughts and feelings so we, as nurses, can relieve their worries. I believe the care can only be provided by nurses who are close to their patients. After I start working as a nurse, I would like to improve my knowledge and skills while thinking about the support I can provide to the patients to live their lives with peace of mind through the power of nursing and not just through drugs or procedures. Thank you for listening.
Thank you, Kiri-san. You did great. Thank you. So, next speaker is Nana-san. Are you ready? So, mic is yours, please.
Thank you, Professor Teshima. Good evening, good day, and to some, everyone. My name is Nana Saito, and I'm deeply grateful for this opportunity to share my nursing journey with you today. I'm still a student, but I would like to talk about why I decided to become a nurse. 6 years ago, when I was still in junior high school, my grandmother lost consciousness due to sudden abdominal pain and was rushed to the hospital. Emergency surgery was performed and she managed to save her life, but even after treatment in the intensive care unit, she did not regain consciousness and was hospitalized for 6 months. Meanwhile, my mother took me to the hospital about 3 times a week for 6 months to visit my grandmother. And each time I saw the work of nurses with my own eyes. Nurses talk to patients every morning, even if the patient is unconscious, about the temperature and weather outside, and even if they know the patient won't respond, they always say a few words to the patient before touching the patient's body. At the time, I was very surprised to see nurses acting as if they were talking to a conscious patient. Through my observations, I realized for the first time that the work of nurse is not always clean. Then I wondered, given that nurses are so busy and it's not a pretty job, why are they able to work with such dedication? What is the rewarding aspect of nursing work? Then I then asked my grandmother's nurse that honest question. She politely answered my curious questions. She told me, "It's true that it's not always a pretty walk that people imagine, but it's rewarding to see patients recover or to see unconscious patients smile at me and talk to me." I was surprised to hear that, and I was deeply moved and admire the work of nurses who are involved in people's lives and look after not just their illnesses, but their entire lives. As a result of these experiences, I wanted to become a nurse, like the woman who cared for my grandmother so devotedly, even though I was still in junior high school. And this was the first reason I decided to become a nurse. Thank you for attention.
Thank you very much for sharing your insights of becoming a nurse. It is really reminding us as well, why we chose nursing. So thank you, Professor Teshima, and thank you, Kiri-san, Nana-san, and I was about to say Megumi-san. Thank you so much. As we move forward, we will have our speakers from Otago Polytechnic, and it is in Dunedin in New Zealand, and it is led by the Professor of Nursing, Dr. Jin Ross. Dr.
Hello.
Ross. Hi.
Hello. Thank you for the invitation. Yes, so we are situated in Aotearoa, New Zealand. And I'd just like to say thank you very much for the invitation to contribute. And just before I introduce the two student nurses, I would just like to say that I'm so pleased to be part of this this networking that we're doing today. It's the afternoon here in Dunedin, because I would really like the opportunity to connect with you in my request to gather data on all WHO regions and support the book that I'm editing, Global Advanced Rural Nursing Practice, situated in rural, remote and island settings, which is endorsed by ICN. And we've just signed the contract last week. I too will be present at Helsinki, and I would love to have the opportunity to meet with you, some of you there, and in the interim to actually develop our notions of advanced nursing practice in rural regions related to WHO. So thank you. So it is my pleasure to introduce firstly Bailey Beecher. And Bailey is a third-year student nurse with us at Otago Polytechnic. She is a more mature student and has a wealth of experience in mental health and theatre, nursing, and she brings this to her practice as a third-year student nurse and will qualify as a registered nurse at the end of 2025. So I hand over to Bailey.
I'll just unmute myself there and hope I get. I'll just jump straight into it. Growing up, I always thought I would be a hospitalization in my early 20s when I realized wanted to be the hand that held theirs when they received bad news. I wanted to be the person providing support and education. I wanted to be the person who was there with the patient and their families, helping answer questions and navigate this fear. I realized during my stay in hospital, being the person in the white coat, making the big calls, it wasn't my calling. Being the person carrying out those actions, being at the bedside of the patient, that was my calling. The issue I had, nursing, such a broad path. What do you do? So for the last 10 years, I've worked in a variety of healthcare settings and levels, from management to a healthcare assistant, mental health to the operating rooms. Honestly, even before joining Otago Polytechnic, I still didn't know where I was heading. I just knew that I had to jump in and do it. My experience within the New Zealand healthcare system, I can see we have some problems here. We have an aging population here in Dunedin, with many of our nurses also in that age group set to retire. So we have an increase in demand and a lack of long-term experienced nurses. It's looking like that's one of the biggest challenges on our horizon. When I talk to my peers, I can see the stress of that, the fear of going into nursing unsupported and not living up to these incredible nurses who have trained us and shaped us. And as a student, I feel like there's not much I can do, right? I cannot replace these nurses with decades of experience, and I can't stop people from aging. So looking at my future, I look at how do I change and shape a way through these issues. And it's through paving my own path to achieve better health for my community. I think we can all agree many of our health systems are reactionary to health issues rather than proactive. It has been one of the most fundamental themes of healthcare that I've witnessed in my time, both as a student and a healthcare professional. We are managing chronic disease and adverse outcomes that we can prevent in hospital. And so I've found my nursing purpose. I believe through strong community healthcare systems and increasing health literacy, localizing resources in our vulnerable communities, we can help people take control to do that. By removing fear of what being ill means, by reducing barriers and meeting people where they are, helping them at their level rather than making them come to us and feel unsupported by long wait lists and rushed appointments in our hospital and emergency rooms. By embracing the legacy of the nurses who have walked before me, using the traits of a nurse, empathy, strength, justice, and advocacy to empower every person that I will work with, to embrace health, embrace illness, and walk with them so that hospitalization doesn't have to be their eventuality. I know it sounds a bit like youthful naivety, like a dream, but we have a saying here in New Zealand, Hia'a te mea nui o te ao. He tangata, he tangata, he tangata. The most important thing in the world, it is the people, it is the people, it is the people. So that's my purpose, my pearl, and the journey I embark on as a student, to learn to shape the future, to be there on the front line with my community. Because that's why we got into health, isn't it? To help, to heal, to be with our people. And I know it'll be a whole system approach to see that change that I want, to see the healthcare system reduced and remade, to reduce this impact of aging and staffing. But I hope I can do my part as one nurse to change the life of one person facing a life-changing diagnosis.
Thank you very much, Bailey. That was inspirational. And I can only help if support you along your journey. And so now we're going to move over and I'm going to introduce Daniela Gaylarwen. And so as I speak about that, we're going to slowly move the camera because I'm also using the same camera. So I will speak as you move the camera. So Daniela is also a third year student nurse, and she is working on a community development project with myself at the moment, which we are achieving to improve health and well-being for others as we work within the community health. So Daniela is from originally the Philippines, and she is undertaking her nursing education as she did in the Philippines, but also in New Zealand. And her interests and her experience has been also in a variety of areas, such as rehabilitation, general practice, and dementia care and urgent care. And I will now hand over to Daniela.
Hi, so first of all, I want to thank the organizers of this series and Jane for giving me this opportunity to share my story with all of you. So to begin, let me take you back to where my nursing journey started. So it wasn't an easy path, but it began 5 years ago with an email that changed everything. So it says, "Congratulations, you have been accepted as a nursing student at our university." So that time I was so happy. I was overwhelmed with happiness because this is what I've been dreaming of. But during that time, this is how I saw it. So study bachelor in nursing, and then couple of years graduate, take the licensure exam, get a job, done. That's how I imagined my life would pan out. But as life often does, things didn't go as planned. What was supposed to be a 4-year nursing journey stretched to 6 years. And now in this 6th year, I've begun to ask myself, what is it about nursing that has kept me going? I've heard a couple of days ago, somebody said this, to walk this tough and gritty path for no reason at all is simply too hard. You need a reason to keep moving forward, a purpose that will keep you grounded, especially during the times when you feel unseen or unappreciated. For me, it's not about rewards. It never was. When I was younger, I thought my reason was clear. I had always been inspired by the medical professionals who cared for my uncle when he was diagnosed with cancer. Watching them in action, I promised myself I would one day be like them. But it wasn't until last year, during a particularly challenging placement with my preceptor, I think I was in acute placement, that I truly understood what kept me going. So that week has been very difficult. Shifts were long, paperwork was piling up, and I had a part-time job on the weekends. Near the end of the placement, one patient stopped me as I was leaving. He looked at me with gratitude and said, "Thank you so much for taking care of this old man. You always go out of your way and put in so much effort. I know you'll be a great nurse one day. Please never lose that caring, gentle side of yours." During that time, I want to cry. I want to cry so bad, but I know that I ugly cry, so I stopped myself. So in that moment, everything clicked. My motivation wasn't just to become like the practitioners I admired as a child. It was about the patients. There are times when it gets too much. But there will always be one patient who reminds you why you're here and why you're working so hard. The sick, the vulnerable, the ones facing uncertainty, they are my motivation. They are why I'm still here. Watching someone regain their health or simply understand their condition reminds me of why I'm in this field, why I'm into nursing. They are the reasons I should never let the fire in my heart be extinguished. Why I need to continue being the nurse who takes good care of her patients and never gives up on them, and why I must never lose that passion, even as I advance in my field in the future. I know that motivation alone hasn't carried me through. My support system has just been as vital. One of the greatest things I've gained through my nursing journey is meeting my best friends. People with whom I've shared laughter, tears, countless late nights. We've been through so much together. My best friends have always been there for me, offering a shoulder to lean on during stressful times and celebrating the small victories together. I'll forever be grateful for them. Even though we've both walked a not so smooth road, we've always had each other's backs, ensuring we reach our destination fulfilled and happy. There have been many twists and turns along the way, but this is just the beginning of my nursing career. While I'm hoping this is the final year of my nursing school journey, 9 months to go, I know the path ahead is long and filled with new opportunities. Looking forward to the future, I see the immense potential nurses have as global leaders. Nurses are natural advocates for healthcare reform, whether through policy influence, collaboration with governments, or involvement with international organizations. We are trusted healthcare professionals with a unique voice, one that can drive meaningful change on a global scale. We have the power to shape policies, improve patient outcomes, and ultimately create a more equitable and compassionate healthcare system for all. As I reflect on my nursing journey, I am reminded of the powerful impact we can all have as nurses. The challenges we face only strengthen our resolve, and our compassion remains the cornerstone of everything we do. With the support of those around us and a commitment to continuous growth, we are not just future nurses. We are future leaders in healthcare, and that to me is the most rewarding part of this journey. Thank you very much.
Really amazing to continue to hear. I wish we had more time. This is just, it limits us all, but it is lovely to really be enkindled by all these stories and experiences and insights from our students, and of course from our academicians who continue to shape the future nurses. So we are really excited that we're able to still do, right, Diva?
Yes.
Our Q&A really opening.
Yes. Just before our Q&A, since we have just a tiny bit of time, I'd like to welcome our friend Anna Eichmann, who our first New Zealand collaborator, who made sure that Dr. Ross and her students could join us. Anna, could you speak to us briefly about how you've seen our project continue, and anything else you'd like to say just briefly before we start our Q&A? Anna?
Kia ora, thank you. Thank you, Diva, and thank you to all the participants and the students, and for the invite to be here as part of the panel. I find that this is a really exciting time. We had our last session last year, February last year, and as a speaker series for the Western Pacific. Now to see the student voices, and thank you to Bailey and Daniela and to Jean, fantastic. From the land of the long white cloud, so pleased to have you on this forum and to be part of the International Leadership for Nurses. The Nightingale Initiative, both for Diva and Barbie Dossi, I trained as an integrative nurse coach in 2013 in New York. And so my my own purpose is around the importance of empathy and value-based leadership, and how we move forward with compassionate care always. So I'm really excited to be part of this further journey, these conversations around globally and around the Western Pacific further consolidates who we are as nurses and the importance of the nurse's voice, and particularly of all our students who have spoken so far today. Thank you for your contribution. You inspire me. All of us are getting at that older age where we're moving off, Bailey. So to be inspired by all these voices, I just think this is amazing. And I so look forward to maybe meeting you all sometime in person, but definitely I'll be down in Otago soon to catch up with Bailey, Danielle, and Jean. So thank you very much, Diva. Thank you to Nai, and thank you to all the organisers and the participants. Kia ora, take care, good health.
Thank you so much, Anna. Now, Tess, we have some time, and do you have some ideas about, do you have some ideas about how to take the Q&A? I have a couple ideas, but what, do you have ideas?
Actually, I would like to start with one lovely question that I could throw to our student speakers. Kua, are you still around?
Yes, I'm here.
Awesome. Okay. So, and then we would love to hear from other student nurses as well on their input. So, given where you are right now, what recommendations do you have to improve current nursing curriculum so we can be more prepared as nurses in the future?
Thank you so much for your question. Personally, nursing curriculum is really important for shaping future nursing students and future leader. But the most important thing is, I think, since AI and nursing technology continues to evolve, however, I think what nursing curriculum needs to have is the heart of pure nursing, and that really teaches human connection, respect, and compassion and responsibility, which is more than just teaching skills and technology in nursing. Yep. Thank you.
Thank you. Anybody else who would like to share any insights?
We need to hear from at least one from each of our nations involved. Go ahead, Bailey.
Actually, Deva.
Hi, kia ora. I have a couple of thoughts on the curriculum from Otago Polytechnic here. In terms of education, our degree is based in placement. So we're in healthcare settings like the hospital, rest homes, and out in the community in a variety of settings there. And I think if I were to have a critique, it would be that the consistency with the training on placement from our our professional RNs, it can be a bit hit and miss. It is a very stressful job and it is very hard, but we're here to learn, and oftentimes you can be left behind as a student. I'm not sure if this is a global issue, but sometimes you can feel a bit left behind as a student. So perhaps there's not so much a problem with our curriculum and how we train, but how we carry on the training out in the real world.
Mm-hmm. Indeed. Who else? Someone from Japan? Someone from the Philippines?
Dr. Lee, I know you want to say something.
Oh, no, I just wanted to make the comment regarding some explanation presented by the Cuevas. So technology competency is already embedded in our nursing education curriculum as a core competence of undergraduate curriculum as well as a graduate curriculum. So I'm wondering how what's going on in other countries in the Western Pacific region. So AI-based curriculum or other healthcare device development, any other digital health related content would be integrated into many of nursing courses or as an independent course, both undergraduate graduate program, I think. So Yonsei has initiating to integrate the core courses, core competence of technology into nursing curriculums. I'm wondering how it's going on in other countries in the West Pacific regions.
That's a really great question. Dr. Wu?
Yes, I think that's really a very good and very important questions because it determines how good, how excellent, competent of our next generation nurses and how the care we will provide for our patients, for our people. So I have been in this area of research for more than 25 years, and we've been taking the competence-based models, but it's not very easy because nursing is both art and science. So we need to prepare our students with their humanitarian skills as well as their competent in skills, in knowledge, and especially the decision-making skills, because this has been more and more important because the patients we are facing becoming more and more complex, and the nurses always at the front and the first line in contacting with people, and they are the first person to find the hint of the condition changes. So we need to prepare our future nurses with very good at clinical reasoning and decision-making skills. So I think with the quick evolving of the technology, if it gives us a very good opportunity to develop our curriculum with that. And just one of my PhD students did, we are developing a virtual learning environment using the current very advanced technology, which is very popular now, large language model, but only large language model is not fits into our nursing profession because there is hallucination generated by the large language models. So we are trying to combine nursing knowledge and to find out what's the best way to represent nursing knowledge in the artificial intelligence system, and in combine with the large language model so that to create our AI driven virtual practice, virtual learning environment with the knowledge and the large language models to allow our students to practice the clinical reasoning and the clinical decision-making skills in a very safe but a very realistic environment, because the decision-making will be, if we make the wrong decision, and it will risk our patients. So we can't let our students to practice those skills in the real clinical setting. We have to give a lot of opportunity to our students to practice in a realistic but risk-free environment to make them familiar with those situations and familiar with the process of decision, clinical reasoning and the decision-making process, so that when they practice in the clinical setting, they are familiar with that and they are more confident and could be make more accurate judgment about patient's condition and make a more appropriate decision-making, how to intervene for the patient condition.
Thank you very much. Very trended. It's both art and science.
Mm-hmm.
The application of which. Ryan?
Yes, thank you. I also agree with Dr. Wu. Well, actually, when it comes to the nursing curriculum nowadays, I think integrating nursing informatics is one that is very essential in preparing the future of our nurses. We know that the rise of technology now, when it comes to digitalization in healthcare, wherein electronic health records, telemedicine, clinical decision support systems, and most of the hospitals nowadays and in healthcare are driven by data analytics. So I guess so that when our nursing students go to these hospitals and have their exposures, I mean, Filipino nurses also, and not only Filipino nurses, but we know that nurses travel a lot also. So they go to other countries to have their practice, they go to conventions and conferences. And by doing this, and providing evidence-based practice based on different clinical guidelines can also have an edge for those nurses and also schools that provides such education for our students as well.
Okay, thank you, Ryan. Let's go to Megumi.
Yes, thank you. Yes, indeed, we need to advance and then technology. How can we use the technology and for next generation and education is really important. Yeah, I agree with you completely. Now I would like to comment the first Yuna's comment. I would like to share my interesting experience. In 2021, ICN revised that the code of ethics. And we together, 10 committee members from all over the world come to Geneva and they discuss about what is a value or what is an important value as a nurse. And all members mentioned about kindness, compassion, respect, and the dignity. And I was very surprised as a member. it is very like a primitive things, but those kind of value is really, really important as a nurse. So we need to go forward. However, we should have that kind of profound foundation as a nurse. Thank you very much.
Definitely, we should never forget that. Very important, those very important values of being a nurse. Dr. Josie, welcome. Barbie?
Oh, okay.
Thank you. Thank you.
Oh, it's been just truly an honor to be here with all of you tonight. And I want to just express that here I am at 82 in my 60th year of nursing. I can't think of anything else I had rather have done with my life. And your conversation tonight, your sharing from your heart, will help me wake up tomorrow to do the next level of my work. We have to remember that history is the most important part of a profession. We all know the name of Florence Nightingale. And I would say to you that every topic and concern and place of suffering Nightingale experienced, and she shared wisdom for it. The people that criticize Nightingale have only read secondary literature. I invite all of you now to look at primary research that you can access on the web through the 16 volumes of Florence Nightingale's the collected works of Florence Nightingale. I would also say that with all the chaos in the world right now, I will speak for myself. I wake up every day and I am anxious for what's going on in my little small town of 60,000 people here in Santa Fe, to what's going on in the United States, of what's going on in the world. And so as a nurse, as a human being, I have to name my suffering. And when we can name our suffering, and it doesn't have to be grand, you just say, the part of me that is most in need of healing right now is. And when we can name that and then have a practice, be it a breathing practice, a meditation practice for 15 minutes or whatever, stretching, anything you name, walking out in nature is a practice. What is it where you can find your own center, where you can find an anchor, where you feel a sense of peace and balance? Because every person, every event that we encounter in the world right now, wherever we live, can throw us off balance. But we as nurses, oh my goodness, thanks for our beautiful profession. We know that we have to come from our heart in order to do the work. And in order to come from our heart, we have to name our suffering. And when we name it, then we find practices to help us with our suffering. And when we name our own suffering, then we are able to see and be and hear the suffering of the people that we take care of. We cannot solve their problems, but what we can do is be in that present moment. And when we are there, and our dear friend Stephen Wright, who is a nurse colleague, he says you're either clear-eyed or you're glassy-eyed. If you're coming from your heart, you are clear-eyed, and people see that. You don't have to say anything else except be present in that moment. If you're glassy-eyed thinking about everything else you need to be, they know that, and y'all all spoke to that. But I invite all of y'all to remember being clear-eyed, naming your suffering every day helps you then do your work in the world. And remember the power of the pause. We frequently, as nurses, want to immediately rattle off everything we know. No, the power of the pause. And I look at Anna there, that and Diva and Tess, we all know that. All of you know it. But sometimes we just get so anxious, we want to tell so much. Remember the power of the pause, and then invite that person just to say, what is one thing you can do right now for yourself? Because patients, clients, they're strong. They know what they need. And when you are there with that power of the pause, something else just, it's transformative. Thank you for letting me share a few words. I love all of you. This is such a blessing. Thank you.
Thank you, Barbie, for everybody's knowledge. Dr. Barbara Josie is a co-founder of the Nightingale Initiative for Global Health and also one of our nursing philosophers. She is the author of the Theory of Integral Nursing, and true to what she just stated. Thank you, Barbie. Now, I know that there was one of our students who want to say something. Ms. Wong?
Yes, thank you, Dr. Benizio. I just want to share some of my thoughts about the question you mentioned about the future nursing curriculum, how to set them for the future nurses. I think it should back to our nurses' core competencies. We should provide the patient-centered care with the new emerging technologies. As I agreed above all the students and professors said, we should integrate the technologies, including digital health, artificial intelligence, to help students develop their abilities, including clinical skills and decision-making abilities, and so on. So I think it's my point. We should still focusing on the problem solving and provide the evidence-based practice, but need to advance our information technologies with the new technologies, but not just the internet or the web-based technologies. And we should training the students use the method simulation, but in an artificial way or virtual reality way. Yeah, and that's my point. Thank you.
Thank you so much. Thank you so much. We really appreciate that, coming from the perspective of our students. As to what Dr. Lee did ask earlier on, just want to circle to that, is across the conversations that we had for the past Student Nurses Voices Speaker Series, there indeed is a disparity or a gap on the curriculum, whether the integration of technology is part or is still continue to be built, to be part, given appropriate resources that they may have. And if we think about that, my perspective to that is, this is where we can all come together. How can we best support each other, each academic institution building our core nurses in the future? How can we best complement them when we have the resources that we needed on the other end? Dr. Wu?
Yes, thank you very much, because this is also the matter I've been thinking about, that especially when I become the chair of the nursing accreditation body of China. And in 2021, WHO issued the first nursing and midwifery data, and showed that there was no international standards, essential standards for nursing education, and the nursing education and the curriculum and its quality is not, there is a lot of disparity between country to countries, and this way will be, there will be very different for nurses to communicate, and also will have different scope of nursing practice around the world. So since 2019, I've been organized a summit inviting the leaders of nursing accreditation bodies from United States and Canada, and we were discussing about the possibility and the feasibility of in establishing an essential standards and the basic curriculums that's international, reach the international level and internationally recognized. But besides that, we also need a tool to secure the quality of nursing education, because only has the curriculum is not enough. We need to have another tool to secure the quality of nursing education. And that's what clinical medicine does. Now the clinical medicine education, they have world recognized the curriculum accreditation system. So we were also discussing about internationally recognized accreditation system, so that we can have the curriculum and we can have the secure system of the quality of nursing education. So this will be a very good thing that international nursing community, especially international nursing education community, need to come together and to discuss that. And ICM will be a very good body to organize this kind of, organization to discuss that issues. Thank you.
Thank you very much. Thank you very much on that insight. Now, Diva, any perspective from your end, having done several, areas on informatics as well, technology?
Thank you. Sorry. Thank you so much, Tess, and for everyone. First, I'd like to say, acknowledge that many of you who are here are speaking and sharing in your second language. And that's remarkable. And also to thank you again for this deeply insightful and cross-cutting, cross-leading across from cradle to grave. It has been so wonderful. One of the people who commented on the chat was our friend Dr. Donna Nikitas from New Jersey, who was one of our major professors for our Western Hemisphere session in December. She said, "Oh, here we are. We're living into global health with this session." How impressed she was about the common ground that we share. And that's one of our major wishes and visions for this series and for what we're doing with the Nightingale Initiative for Global Health. Thanks again so much. Now, at this end of this session, we end with PowerPoint that I read from. Francesco, if we could have our Nightingale Declaration for a Healthy World. The Nightingale Declaration for a Healthy World is now available in 14 languages, and including for our Western Pacific in Tagalog Filipino, in Chinese, and in Korean. And I would invite Megumi and Japanese students to consider helping us to have a Japanese version, as well as possibly having conversations about including Indigenous South Pacific languages. Would be wonderful to do this. And so I will now start with this Nightingale Declaration, also to say just briefly that this declaration was brought forward in the year 2003 in Toronto, when the SARS epidemic, that was actually a precursor to COVID, was rampant in Canada, and nurses and patients were dying. And we decided to create this Nightingale Declaration in order to help people to commit to a healthy world, but also to talk about how we could be communicators to call for a healthy world. And with this now, I'm going to read from our slides for the Nightingale Declaration for a Healthy World. If you like, you can be speaking with me. The words will be on the screen. Francesco, go ahead. We, the nurses and concerned citizens of the global community, hereby dedicate ourselves to achieve a healthy world. We declare our willingness to unite in programs of action, to share information and solutions, and to improve health conditions for all humanity, locally, nationally, and globally. We further resolve to adopt personal practices and to implement public policies in our communities and nations, making this goal achievable and inevitable, beginning today in our own lives, in the life of our nations, and in the world at large. Florence Nightingale, what did she envision for us? In 1893, she said, and this is still true, we are only on the threshold of nursing. In the future, which I shall not see, for I am old, may a better way be opened. May we hope that when we are all dead and gone, leaders will arise who have been personally experienced in the hard, practical work, the difficulties and the joys of organizing nursing reforms, and who will lead far beyond anything we have done. Florence Nightingale would be awed with just what you have all achieved tonight, in this morning, wherever you are. You are already living into her vision. Please join us with your voice, looking at our 14 language versions of the Declaration, looking for more language versions. Next. And just to let you know, on March 11th, we're going to have student nurses' voices from Southeast Asia. And we're working on the dynamic work that nurses and student nurses in that part of the world will be sharing with us in March. And in April, we hope to have the Middle Eastern nurses. In May, we hope to have the European nurses. And in June, a session that it brings us all together and it moves us ahead toward what we can do next with this project to bring public voices to nurses, from nurses to the world. Thank you so much, Francesco. Tess?
Oh, thank you so much. I actually just posted, let us just be reminded that with everything that we say, that we all come together, that global is also local. You know,
Yes.
as we look into the outside world, in the other nations as well, we also want to look at the one beside us.
That's right.
Along into this journey. And yes, we will never forget the humanitarian values, the values that Florence Nightingale laid upon us for nurses to be able to care for, but also to be cared by each one of us. Because by the end of the day, we all need to be with each other. We need to hold hands. And that reminded me with Gallup here in the United States, the nurses have been acclaimed as to be the trustworthy for how many years now? It's more than 20 years, trustworthy profession. And yes, let's keep that. It is now upon each one of us to do that. And of course, with Miss Iro's language from our first session before, it is the people, it is the people. I wish I could say that in that language, the Kia ora. Sorry, I don't know what's next, but thank you so much. And we're looking forward to your continued engagement. Join us in our succeeding series, and we will reach out to you as we put our concepts together so we can continue to move forward and spread this out, not just within our group right now, but spreading it out across the different colleagues of us, different academic institutions. Thank you. Diva?
Yes, just one more thing. We'll have a recording of this session posted with each of your bios and faces on a special website devoted to this session. And we'll also be, when we post it, each of you will also note when your presentation started so that you can use our webpage as your resource for taking this forward so that it isn't just one day, one morning, or one afternoon, or one evening. What we are doing with you today will be recorded for people to see. Thank you so much, Francesco.
Thank you, Francesco.
Thank you. Thank you. I just wanted to also quickly say thank you to everybody. Well, thank you to you, Tess and Diva, for helping put the session and the series together. Thank you to all of the professors for supporting the series and for helping bring your students. And of course, thank you to the students for sharing all of your wonderful stories. And finally, just thank you to the audience for taking the time to join us and be here today. I hope you found it as valuable as I did. And yeah, with that, just wanted to reiterate what Diva said quickly. The recording will be up in a couple of hours and will be up on our YouTube, and it'll also be up on the CFL event page and, as Diva mentioned, on the Nightingale Initiative for Global Health page. And to echo what Tess said as well, just a reminder that our next session is March 11th with students from Southeast Asia. So I've shared our social media and our YouTube channel in the chat. Please feel free to share the recording of this session and the registration for the series with your networks. Anyone who might be interested, registration is always free and is open until the very end of the series. So with that, just one big final thanks to everybody. Thank you so much. It was a great session. I hope everybody has a great rest of your day.
Thank you.